Hello and welcome. This is Dr. Raja and I'm back to you guys with another video. And today we're discussing the differences between Hodgkin and non-Hodgkin's lymphoma. So there is a very characteristic feature in case of Hodgkin's lymphoma, and if you would find that feature, then it's confirmed that this is Hodgkin's lymphoma, and that feature is Reed Sternberg Reed-Sternberg cell. This is the characteristic feature in case of Hodgkin's lymphoma. So what is Reed-Sternberg cell? This is present in Hodgkin's lymphoma, but it's absent in case of non-Hodgkin's. So this is a very characteristic feature in case of Hodgkin's lymphoma. So what is a Reed-Sternberg cell? Reed-Sternberg cell, here is the Reed-Sternberg cell, and if you would look it in the microscope, under the microscope, you will find that it is a binucleated. It is a binucleated, and both the nucleus are mirror image to each other. As you can see, they're mirror image to each other, having centrally placed nuclei. So it is a binucleated, and both the nucleus are mirror image to each other, having centrally placed nuclei. So this is Reed-Sternberg cell, and this will be the characteristic feature in case of Hodgkin's lymphoma, and this will give oval eye appearance. As you can see, it looks like an oval eye, so it will give an oval eye appearance. So this is Reed-Sternberg cell, and it will have two surface markers. One will be CD15 and CD30. These are the surface markers which will be positive in some variants of Hodgkin's lymphoma, and which will be negative in some variants of Hodgkin's lymphoma. We'll come to the variants of Hodgkin's lymphoma, but first of all, you just remember that this is the characteristic feature. Reed-Sternberg cell is a characteristic feature in case of Hodgkin's lymphoma, and it will be absent in non-Hodgkin's lymphoma. So this was the first feature, first difference. So next is, in Hodgkin's lymphoma, there is a WHO classification we have discussed in our previous video, and which is based on degree of classification, whereas in non-Hodgkin's there is a real classification. We have discussed it in our previous video, so I'm not gonna explain it. So there is in non-Hodgkin's there is real classification, which is based on type of cell. It is based on type of cell involved. Yeah, this is another feature. So what else could be there is that a patient of Hodgkin's lymphoma will come to you, will present. Always remember that the patient of Hodgkin's lymphoma will present to the clinic or hospital or to you with superficial, painless, non-tender and rubbery lymphadenopathy upon alcohol intake. If a patient is alcoholic and whenever he will take alcohol, then he's gonna face these symptoms, whereas there will be no pain after alcohol intake. So this is one of the features. The patients who drink alcohol, they will be facing these symptoms, whereas they won't face the other. In non-Hodgkin's, there won't be any pain after alcohol intake. So this was one. And next is in Hodgkin's lymphoma, extranodal involvement is less common. It will just be the lymph nodes in most of the cases which are like involved, and whereas in non-Hodgkin's, extranodal involvement is very common. Which means that the malignancy can arise from any other place, not just the lymph nodes. In non-Hodgkin's lymphoma, it can involve the other organs as well. For example, hepatomegaly, liver. It can also present with hepatomegaly, splenomegaly. Spleen can be involved, so there will be splenomegaly. There will be orchidomegaly, which is the enlarged testis, and there will be CNS will be involved. It can be involved, and the CNS features can be meningism and cranial nerve 7 involvement. So there could be facial palsy and all that in non-Hodgkin's lymphoma. This is very common. Extranodal involvement is very common. The most common presentation in case of Hodgkin's lymphoma is cervical plus mediastinal lymphadenopathy. The most common presentation in case of Hodgkin's lymphoma is cervical plus mediastinal lymphadenopathy, whereas in case of non-Hodgkin's, it could be anywhere. As we have seen that its extranodal involvement is very common, so it's not just one place, it could be any. This is common, most common, meaning 60 to 90% of the patients present with cervical plus mediastinal lymphadenopathy, whereas they could also present as axillary and inguinal lymph nodes can also be involved, but they are less common. Axillary and inguinal lymph nodes can also be involved, but they are less common. 60 to 90% is cervical plus mediastinal lymphadenopathy. And in case of non-Hodgkin's, it could be anywhere, not just lymph nodes, as it's very common in other organs as well. 25% of the patients face constitutional symptoms. Constitutional symptoms, which are Pell, Epstein, fever, which is the fever that goes on and off, that goes and comes. The fever that goes and comes, like on and off fever, is like one of the constitutional symptoms in 25% of the patients with Hodgkin's lymphoma, and this type of fever is called Pell-Epstein fever. This is Pell-Epstein fever. Whereas in case of non-Hodgkin's, it will be low-grade fever. It will be low-grade fever, and in 25% of the patients, one will be Epstein-Barr fever in the constitutional symptoms, and the second symptom, the constitutional symptom, will be weight loss. It's just in 25% of the patients. We know the common presentation will be cervical plus mediastinal lymphadenopathy, and there will be drenching sweat. Drenching sweat is another feature. We have discussed there will be Pell-Epstein fever, is weight loss, and there is drenching sweat. These are the three constitutional symptoms seen in case of Hodgkin's lymphoma. Whereas there won't be this weight loss is less common. Weight loss plus this drenching sweat, I will just write D, is less common in case of non-Hodgkin's lymphoma. Okay, so these are the symptoms, the constitutional symptoms that will be less common in non-Hodgkin's lymphoma, whereas they are common in 25% of the patients with Hodgkin's lymphoma. Next is in Hodgkin's lymphoma there will be contiguous, or we can call it stepladder pattern involvement of lymph node. Contiguous stepladder pattern involvement of lymph node means a consecutive pattern, meaning it will go on with cervical, then mediastinal, then axillary, then inguinal, like that. It will go in a pattern, like in a sequence. That is contiguous. Contiguous or stepladder pattern involvement of lymph node is seen in case of Hodgkin's lymphoma, like consecutive in a pattern. First will be involved like cervical, then mediastinal lymph node could be involved, then axillary, and then inguinal, like that. Whereas in case of non-Hodgkin's lymphoma, there won't be this pattern. This pattern will be absent, and it could be anywhere. It could start from anywhere. Could start, could involve anyone at first. It could be anywhere. The neural involvement could start from anywhere, not just in a pattern like cervical first, then mediastinal. It could start from anywhere. So these were the differences between Hodgkin's and non-Hodgkin's lymphoma. All you have to remember is this characteristic feature, which is Reed-Sternberg cell. You have to remember this. This is a characteristic feature. It will be present in Hodgkin's lymphoma, whereas it's absent in non-Hodgkin's lymphoma. And what is Reed-Sternberg cell? It is a binucleated, having two nuclei which are mirror image to each other, and centrally placed nuclei, having centrally placed nuclei, and giving an owl eye appearance. As you can see, this is giving an oval eye appearance, and it has two surface markers which are for different variants of Hodgkin's lymphoma. Some are positive and some are negative. So this is CD30 and CD15, two surface markers found on Reed-Sternberg cell. So this is it. Stay tuned for my next video, and I will be discussing the next malignancies, the remaining malignancies like ALL and AML. Until then, take care. I love you guys. See you next time.